CataractCoach.com. All residents must know how to load the IOL into the injector. Let's watch carefully. There's a single piece acrylic lens. So we grab the lens, there it is, there's a dollop of viscoelastic and coating both sides in it, making sure you have the correct side up. Remember, it's the anti-S. It should never look like the letter S. Now we have our cartridge, which has been filled with viscoelastic already. We'll fold over the leading haptic, put the optic in, put the trailing haptic, push it down the plunger. Easy as that. Engage it into the injector, advance the plunger, ready to go. Let's put this inside the eye. It is so critical for you as a surgeon to be in charge of every aspect of the surgery, and that includes loading the lens, includes setting up the phaco machine, draping the patient, everything. What if you have a different scrub tech that day who's not as familiar? You can't hold up the whole day. You've got to be able to do every single step of the procedure, including loading the lens into the injector. And we have too many residents who come to the operating room unprepared to do this. So we're going to review this 6 times today. Next video. Same thing. So there's the cartridge. We can fill it with our viscoelastic. You can use a cohesive or dispersive. We have a separate video as to which viscoelastic would be better in which circumstances. Now we get the IOL, which comes, in this case, holding it in our palm. There's a dollop of viscoelastic. We can coat the IOL. Being very careful to keep the correct orientation. Again, the anti-S. The leading haptic is flipped over the optic to put in the injector. Trailing haptic put on top as well. So now both haptics are on top of the optic. Push it down the plunger as far as it goes the forceps. Click it into the injector. Make sure it clicks all the way. Advance the plunger. It's ready to go. And now we can go back and deliver this inside the eye. So you don't want to load the lens too early in the process because you don't want it to sit folded up in the injector for a long period of time. So here comes the lens. Watch how we inject it, keeping the eye in primary, delivering it into the capsular bag. Once we think we're near the capsular equator, we inject while pulling out the rest of the injector tip. Use our chopper now to ensure that both haptics unfold appropriately into the capsular bag. Number 3, watching again. A little bit of viscoelastic. Here using a little bit of a cohesive viscoelastic. And there's the IOL. We're going to coat both sides of it with the viscoelastic, grabbing it there, non-toothed forceps, very important. Flip the leading haptic over, put the optic in one clean motion. Grab the trailing haptic. Now both haptics are on top of the optic. Push it down the plunger. Now click the cartridge into the injector. It'll click into place. Advance the plunger. And there we go, ready to go. Ready to put it in the eye. Now let's go back to the eye. Let's zoom in here. And now we can fixate the eye with the chopper and put the IOL inside the capsular bag. So here, delivering the lens, nice and easy. Notice how the eye stays in primary, delivering the lens. And now we can use our chopper to make sure that both haptics are in the capsular bag completely. Looking good. All righty. Case number 4. So I told you, this is very important. I want to get this right. And I watch over and over again. More viscoelastic on top of the IOL. Again, notice how both the cartridge and the lens disc are in the same hand. There you go. Coating with viscoelastic. Anti-S formation is correct. There's also a picture on the cartridge if you forget. Put that in, flipping over the leading haptic. Now putting over the trailing haptic. Both haptics on top of the optic. Pushing it down the chute. Now we can get our cartridge and connect it, insert it into the injector, make sure it clicks in all the way, advance the plunger, ready to go. And now we can deliver this inside the eye. So this is obviously the procedure for these single-piece hydrophobic acrylic IOLs. You'll obviously use different lenses in the future from different manufacturers that have different techniques of being delivered and loaded, and you'll have to learn those as well. Make sure you as a surgeon are in charge of every step of the procedure, and you can do every step if need be. At the end of the day, it's your responsibility. Alrighty, case 5. We're going to watch it again. A little bit of viscoelastic on the IOL. Now we're going to get the cartridge. Here's the cartridge. Let's fill it up with the viscoelastic as well. Good, complete fill of viscoelastic. There it is. Now holding them in the same hand. There's the IOL. Picking it up with non-tooth forceps, making sure it's coated in viscoelastic. Now we can bring it over, fold over the leading haptic on top of the optic. So there's the IOL. Let's fold it over, push it over. Good. And now the trailing haptic on top, and both of the haptics now are on top of the optic, and it's pushed down the plunger. Now we click it into the injector, make sure it clicks in all the way. There's the side view, advance the plunger, and here comes the IOL being folded as it goes down the funnel tip. Go back to the eye here, zoom in appropriately, adjust your focus. There you can see the capsular rhexis. And let's deliver this lens. Now watch how we deliver it. A little bit of counter traction, aiming it inside the capsular bag, keeping the eye in primary. There's the IOL, going in very nicely. Notice how we don't shove it towards the nasal equator. We insert it very gently in the capsular bag. Capsular bags are very delicate tissues. Got to be very careful, make sure it unfolds completely. Alrighty. The 6th case, last one here. You must be an expert by now. Watch carefully. So you can see I have a viscoelastic in my hand. We're going to fill up the cartridge. This is a dispersive viscoelastic this time. And there's some viscoelastic on the IOL. Now the dispersive is more lubricating. The cohesive is easier to remove and less prone to stick to the IOL optic. And so there's a separate video on Cataract Coach that I want you to watch that explains that. So leading haptic folded over the optic goes in the cartridge, trailing haptic now picked up and put on the optic as well. So both haptics are sitting on top of the optic. Push it down the plunger now. Let's click the cartridge into the injector. There we go. Advance the plunger, and it comes down the funnel tip. Now here, I showed you this video because the trailing haptic unfolded a little bit. But that's okay. As long as it doesn't get caught in the injector, we can deliver in the eye, and then we can still open it up appropriately. So again, there's the capsular rhexis. Here comes the lens. A little bit of counter traction with the chopper, getting that inside the eye. There it is. Delivering the lens. And remember the trailing haptic, it's a little bit malfolded, but of no consequence. It unfolds appropriately. So these are very malleable, very forgiving. So please review this. I want each and every one of you to be able to load this lens into the injector without any issues. Thank you.